I realize that as a PT, we talk all the time about movement, about strength, about tummy time, and all of these things can have such an impact on these babies. And of course, a lot of times people will come to us, and now I realize that they have tongue ties, but I would see them later on in their life when they were having some difficulties with rolling, with crawling, with walking, and those kinds of things. And it turns out that they had this tightness and stiffness all along, and it was probably from in utero or from their birthing process, a tongue tie that was not either detected. And anyways, it's become such a great part of my practice. And I always say my true goal is to keep kids out of physical therapy. So the more that we do up front in educating mamas and how to get help, then the better you guys are at teaching your kids how to move and all that kind of stuff. I want to jump right into our topic today, and that is a bunch of things that you can do for your baby if they've had a lip or tongue tie procedure done. The cool thing also is that those same things that I would do after a tongue tie are very similar to what I would do before the tongue tie procedure. So let's say you live in a place where you don't have access to have the tongue tie, and let's say maybe they have a long wait list or it's too expensive. I hear all these different things, or you're afraid to put your baby through a procedure. So all of these things are activities that you can do with your baby, whether they've had the tongue tie procedure or lip tie, or they have not yet had it, or you choose not to do it. And that's a whole other education piece in and of itself that we can talk about another time. But what I really want to give you today is very practical tips that you can start doing immediately and start seeing progress immediately. When a baby has a lip or tongue tie, there's some kind of restriction, okay? So the tongue is actually attached to the bottom of the mouth, which ultimately through fascia is attached to the spine. So a lot of these babies have a lot of stiffness. And if you saw my video, you would see that the baby's shoulders are way up high, their hands are really fisted, especially when they're trying to eat. And that's because it's so hard for them to eat. Their tongue is tied down to the bottom of their mouth. What a tongue needs to do is elevate, cup around. I call it like a hot dog in a hot dog bun. That tongue has to be right around the nipple, cupping and suctioned and up and elevated in order to effectively draw milk out of whether it's a bottle or a breast. And when it can't do that, the baby struggles, and so you see their shoulders are high and they're clenching their fists and they've got all this tightness here, and it's really hard for them to feed. I find that there's, generally speaking, two kinds of babies. There's the super aggressive ones that will chomp and bite and get the food out of mama. And then there's the babies that are a little bit more, they're labeled as lazy. So they are trying so hard that they fall asleep. They fall off the nipple. They, are never satisfied. They fall asleep after 2-3 minutes of eating, and then they wake up and they're hungry again. And these are the ones that are constantly feeding all day. Those are generally the two types that we see, both of which have tightness. What I always say as well is that the provider that is doing the release can fix the anatomy. So they go in, they cut the tongue, they make it move again and restore that normal motion. But what doesn't always happen is the function isn't fixed. And when we talk about function, we talk about the ability to eat, the ability to breathe through the nose, the ability to sleep without snoring with your mouth closed. All these things that we see as tongue-tied babies can be impacted. And so the function isn't always fixed just because the anatomy is fixed. So what that means is, let's say Dr. Baxter, in his tongue-tied book, which is an excellent read, he says, imagine you take your two shoelaces from both your shoes, tie them together, and that's how you train for a marathon. Okay, and then game day comes, or marathon day comes, and you take the shoelaces out, right? Well, you've been training this whole time with your feet together. And so that pattern of movement that you've learned, that muscle memory, isn't going to change just because you've released those shoelaces. It's in there and it's embedded in your brain. And that's why body work is so important. That's why exercises and movement is so important. And of course, the suck training, which is when we, as the oral motor specialists, teach your babies how to correctly suck to remove that milk from the breast or bottle.